Hello everyone and welcome to week 8, day number 2. Unfortunately, because this week is Thanksgiving, we will not be meeting on campus, but I still wanted to give you the video information so you guys can still review this as we will be going over it in week number 9. So please make sure that you still watch the video and get an idea of what we're going to be talking about this week. So if you remember from the day 1 video, I said that we had 3 chapters that we were going to discuss this week, chapters 53, 54, and 55. On the day 1 video, I did talk about and discuss chapters 53 and 54, as well as we talked about that day 1 in the lab. So for this video, I'm going to talk about chapter 55, which focuses on medication administration. What this chapter will really focus on is understanding how to give different types and kinds of medications, as well as all the forms that the medication comes in. So chapter 55 starts off by talking about medications and how they can be administered. And they can be administered in several different forms, such as orally, topically, rectally, by inhalation, by injection, and then in a subcutaneous or a intradermal manner. Oral medications is where the medication is swallowed and entered into the tissues of the GI tract, then that gets absorbed into your cardiovascular system and your circulatory system. Oral medications can be pills, syrups, or other liquids. They can also be sublingual, which means they go under your tongue and get dissolved in that manner, or buccal medications, which would be where you put it on the inside of your cheek and it gets absorbed into the cheek muscles there. Topical medications are used for dermal application or mucosal application. If it's a dermal application, they're either creams or ointments, lotions, or skin patches. And those would be what you would put on your skin, and they get absorbed through your skin and tissues. Mucosal medications are things like eye drops, ear drops, and nose drops, eye ointments, vaginal creams, rectal or vaginal suppositories, or sterile douches. Now, it's sometimes very important that when you're administering any kind of topical medication, you want to make sure that you are wearing gloves so you don't absorb the medication yourself into your own body. It should be the patient that's absorbing it, not yourself. So any type of medications that you're giving that are topical, always make sure you're wearing gloves. Rectal medications, I think, make sense, so I'm not going to talk too much about those ones. Inhalation medications are things such as either inhalers, or if you have a nebulizer treatment, it's something that is breathed into the lungs and helps to open up lung airways that way. Now, injectable medications are also called parenteral. What that means is that these medications are administered outside of your GI tract. So unlike the oral medications that you swallow and then they go through your GI tract, these ones go directly to the bloodstreams or the circulatory systems right away. These could be medications such as an intramuscular method, the subcutaneous, or the intradermal method. The intramuscular method is given directly into your muscles at a 90-degree angle. And there are 4 sites that we can give intramuscular injections to. The deltoid muscle, or the upper outer surface of the upper arm. The vastus lateralis muscle, which is the outer portion of the upper thigh. The dorsal gluteal muscle, which is the upper quadrant of the buttocks. Or the ventral gluteal, which is given in the iliac crest of the leg. Subcutaneous injections are given just under that first layer of skin into the fatty tissues. They're used for small doses of non-irritating medications. We can use the back of the arm, like you've learned in class, the upper back, the abdomen, or the thighs. And lastly, the intradermal. Most commonly what we do is either TB testing or allergy skin testing. The medication is administered within the top layer of skin, and these can be done in the upper chest, upper back, or the forearm is where we've learned to do it, but you could use the other two sites as well. So when you're administering medications, it's always important to follow what we call the 3 befores, which states that medications must be checked at least 3 times before you administer it. The first time should be before the medication is removed from the cabinet. The second check should come when the medication is poured, drawn up into a syringe, or placed into a medication cup. And the last time should be before the medication is returned to the cabinet where you got it from, or before you administer it to the patient. The other thing that you must follow is what we call the 7 rights of drug administration. The 7 rights are the right patient, the right drug or medication, the right dose, the right route, the right time, the right documentation, and patients always have the right to refuse. Now, there are times that this happens where you get an order from a provider, they say that the patient wants it, you draw it up, you do everything that you're supposed to do, and when you get in there, the patient refuses the medication. They feel sometimes that they're pressured by the provider, and once that happens, don't administer that medication. Simply walk back out, talk to your provider, and let them know that they've refused the medication. Patients always have the right to do that. The way that we can check if we have the right patient is making sure that we ask them for their name and their date of birth, and we can check that against the order. The right medication comes very easily if you're using the 3 befores. The right dose is making sure that you're verifying what you've drawn up or what you have in your medication cup compared to what the medication order is. The right time comes as if the medication needs to be given before or after food. This is more hospital-based. Also making sure that if the patient's supposed to be fasting or non-fasting. The right route is are we giving it the correct way? Is it supposed to be an oral medication? Is it supposed to be a topical? Is it supposed to be a rectal medication? Is it supposed to be an injectable or an inhalation medication? Making sure that we're giving that medication in the right route. And then right documentation is making sure that you document what you've done and what you've given. If you don't document it, it wasn't done. Now, because medical assistants will most likely be responsible for administration of injections, it's really important that you know all the forms that injectable medications can come in. Medications that were given for injections can come as vials, ampules, pre-filled syringes, or powder medications. Now, vial medications are things that we know and work with. You guys have been working with those already. We have multi-dose vials where you clean the top and you can draw multiple times out of it. But we also have what we call single-dose vials, which are a one-time use only, and it has just enough medication for one-time use. Your vials can be either plastic or glass, and they always have a rubber stopper. So depending on how you're drawing this up, you'll always have 2 needles. Remember, the one for drawing up and the one for injecting. Ampules are these ones here that you see. Each of them has either a blue or an orange line on them. And what that is they're small, sealed glass bottles that contain a single dose of medication. Because they are sealed as such, what you'll have to do is actually break the top off before you can draw up with this medication. When you're breaking the tops off, so you always want to go where you see that blue or that orange line, that's where you're going to break it. You always want to use a cotton pad or a gauze pad to break this open, so that way you don't actually end up putting glass into your hand. And when you are drawing up these medications, we use what we call a filter needle. So that way, if there are any small, tiny glass particles that have broken off and into the solution, they will not actually be drawn up into the syringe. the filter needle will keep that glass out. Pre-filled syringes are what you see down here in this picture. And what that means is it's a syringe that already contains the medication. So you don't really have to do anything to draw up the medication. All you need to do is put on the needle itself. This is really a convenient thing for medical assistants. It's very time saving. So instead of having to take the time to draw up the medication, it's already done for you. All you have to do is put on a needle and you're ready to go. And the last medication form that we have is this powder form, which you see right here in this picture. And powder medications are things that come in a vial like this in their powder form, and what we need to do is what we call reconstitute them. So we reconstitute a medication by adding a certain amount of diluent or sterile water to the powder itself. Then we can actually create the liquid form of a medication once you have added that diluent. And these are very easy to draw up, and some medications are still given this way. For example, I know that the MMR for children is still given as a powder form, and you have to reconstitute it to a specific medication dose. You make that dosage based on the amount of solution that's added to the medication, either dilutes it to a certain medication dosage, or if you don't add as much water, it keeps it at a higher dosage. Alright guys, that is all I have for you this week. Again, because Thanksgiving is going to be on day 2, we will not be meeting on campus, but it's still important for you guys to have an idea about these medications and medication administration, as this will be something that we will talk about and deal with day 1 of week 9. So please make sure that, again, you read your chapter or you watch this video. I would prefer both, but if you're going to do one or the other, read. Definitely reading is always best. This will also help with taking your quiz in your online lecture class this quarter. Again, if you have any questions, make sure that you bring them week 9 to class, or you can always email me through Blackboard and we can talk that way as well. Alright guys, have a wonderful day and happy Thanksgiving. I'll see you in week number 9. Bye guys.